Long story short, I'm a doctor. It was the International White Coats Day, so traditionally, I celebrated it wearing a suit. I blew out my cake and ate candles. Let's count it as a celebration. I took off the suit, put on a lab coat, cause just before that, I'd become a GP. I had a stylish hat and wicked earphones. In fact, they didn't fit my phone, but whatever. After the first week of the GP job, I noticed that if you put that flat stuff on your chest, you got a cool beat. Anyway, I needed to concentrate, cause I expected my next patient in 15 minutes. Right, I'm working from home, but in no time, my personal office in hospital will be ready and I'll work up to my full potential. There were 5 minutes left. I found my patient's medical history, made a story of it on Instagram, put it in a history textbook, then somebody knocked on the door. My patient and I walked into my room. She complained of her left ear fatigue and unhealthiness. Why doesn't anyone complain of overhealthiness? I wrote down her symptoms. Then I analyzed it and thought how I could help the victim. I mean, the ill person. The patient sneezed. I pulled a mask onto my nose, gave her a piece of paper. Her eyes widened and she started to choke. Sure, nowadays, medicines cost an arm and a leg. The patient paid me and sadly headed for the door. Ah, well, that's how I work day in and day out. My next appointment was in 10 minutes. I needed to be prepared. I did some practice in writing out certificates, in showing off with incomprehensible medical terminology, unclear even to myself. I also honed variations of pronunciation of the word next. My next patient had a computer addiction. Looked shady, it wasn't my specialization. Who cared? My patient showed up soon. We went to the room. I sat down on the couch. The patient looked at my computer with admiration. Apparently, it was a huge problem. He asked what games I had. Before I had time to answer, he started looking through the folders on the desktop. How impolite of him. At least he could have taken his shoes off. I was trying to ask questions about his illness, but he didn't react. In about 10 minutes, he admitted that he'd never played such a powerful computer. Well, let's assume it was a part of our therapy. Moreover, I charged by the hour. He was so carried away with the game without lags that 7 hours had passed. But it was time to distract him, or else he would go broke. I shut down the computer and examined the patient. I got it. I gave him a phone and he started playing it enthusiastically. Well, the problem was solved. We hadn't talked about phone addiction. The patient paid and left. Next day, I was called and said that my office was finally ready. Good news! I packed all my stuff and set off. That was a classic clinic with brand new equipment and tricked out things. That's what I saw in the description. But in reality, it was a shabby place with gloomy atmosphere. Well, that wasn't what I was dreaming of a whole week. But there was nothing I could do. Really, there was nothing to do. I was about to go to the head doctor with complaints, but my first patient came in. I offered him to sit comfortably on the couch. We both felt awkward. I offered him tea. Tea? What the hell was I doing? I asked the patient what brought him in. He said that his whole body hurt. What do you mean by the whole? All what's possible. All organs are body parts. Well, I needed to brainstorm. I examined all his tests, all x-rays, looked through his huge medical history. I didn't know what diagnosis to make and how to treat it. Another doctor came in. I told him it was my first day and asked for help with the difficult patient. We began to examine the patient together. The doctor said that it was easy and prescribed sulfamonibutyridol, hydroxyrothylene, and bed rest to the patient. In a couple of days, he would be as fresh as a daisy. The patient thanked us and left. We stayed alone with the doctor. I thanked him too and walked out. Then I realized that it was my office. Came back and started asking him about subtleties of our profession. He was a good guy who was aware of all the particulars of medical business. Then he taught me how to diagnose by sight, measure the pulse by touching clothes, and even to heal open fractures by phone number. Awesome! I thanked him again and he left. In a couple of minutes, our head doctor came in and asked, "Look, one crazy patient has escaped from the psychiatric ward. He imagines himself to be a general practitioner and gives out stupid advice. Haven't you seen him by chance?" Long story short, I'm a doctor. Thanks for subscribing to our channel and for likes. We're very pleased. By the way, don't forget to watch the previous videos. They are fascinating. Thank you for watching. We will be waiting for you again.